Nobody at Sunridge Veterans Psychiatric Center wanted to fight for the man in room 7. The psychiatrist called him a lost cause. The social workers called him a liability. The night staff called him difficult because he tapped on his bed rail until 2 in the morning, and nobody could get him to stop. Only one nurse, in faded blue scrubs, always slightly too large, believed the tapping wasn't agitation. She believed it was a message. Staff Sergeant Derek Callum had been at Sunridge for 11 weeks when Maya Quinn first noticed the pattern. He was 57 years old, former Army Special Forces, 2 decades in intelligence work that nobody at the facility had clearance to discuss. The intake paperwork listed a traumatic brain injury from an IED strike in Logar Province 2011, and a diagnosis that had followed him from base hospital to VA clinic to Sunridge like a shadow nobody could shake loose. Rapid onset dementia, moderate to severe, poor prognosis for recovery. The paperwork said he was confused, agitated, non-communicative except for episodes of shouting that the staff had learned to manage with medication. He could not reliably remember where he was. He did not always recognize his daughter when she visited. He tapped on things constantly, the bed rail, the window frame, the tray table, and nobody could explain it, and after a while nobody tried. Maya had been working the unit for 14 months. She was 34, lean in the way of someone who had never fully stopped moving, with dark eyes that stayed low around the attending physicians, because she had learned early that quiet nurses lasted longer on wards ruled by proud men. Her hair was usually pulled back fast, not carefully. She looked like a person who had arrived from somewhere else and never quite finished the transition. She was. Nobody at Sunridge knew what she had been before the scrubs. Her personnel file said Air Force administrative role, early separation. It did not say anything about the years in between. It did not say anything about the 15 months she had spent attached to a joint special operations task force running personnel recovery in eastern Afghanistan. It did not say anything about the 2 men she had carried out of a burning vehicle in Kunar Province, with a broken rib and someone else's blood in her eyes. It said nothing about the call sign her team had given her, because she had a habit of showing up exactly when survival required it, and disappearing before anyone could ask how. She did not display the medals. She did not mention the deployments. She wore her badge straight and her voice low, and she did her job. And every morning she checked on Derek Callum in room 7, because something about his pattern of tapping had been bothering her since the first week. The tapping was the thing. It started the same way every evening, around 9, when the ward quieted and the overhead fluorescents dimmed to their overnight setting. Derek would lie on his side facing the window, and his right hand would find the bed rail, and he would begin. Not random. Not anxious. Deliberate. Short, long, short, pause. Long, long, short, short, pause. A structure underneath the sound that most people would walk past without catching. The way you walk past a conversation in a language you almost speak. Maya stood outside his door on a Tuesday evening and listened for 4 full minutes before she was certain. Tap code. A 5x5 grid system, pairs of taps for each letter. It was older than most modern military communication, carried forward through generations of prisoners of war who had no other language left. Special forces still taught it. Maya had learned it in a classroom in 2013 from a retired Green Beret who smelled like tobacco, and told them that sometimes the only signal you had left was your own body against whatever surface they hadn't taken from you yet. Derek Callum was not confused. Derek Callum was sending a message to anyone who could read it. She listened another minute. HELP. She pushed the door open. He was lying on his side exactly as he always was, eyes open, fixed on the dark window. His hand stopped moving when she entered. His expression did not change. He looked at her the way a man looks at one more stranger in a long line of strangers. Maya pulled the chair beside the bed and sat down. She set her hands on the bed rail, not gripping it, just near. Then slowly she tapped once, paused twice. His eyes moved to her hands. She did it again, the first letters of the grid. Acknowledgement. Derek Callum's jaw tightened. A tremor crossed his throat. He looked from her hands to her face, and she held still and let him look. Then his right hand came back to the rail. READY. Maya exhaled slowly through her nose. She did not let her expression change, because she did not know who might be watching through the narrow window in the door. She reached for his chart folder on the side table and opened it like she was reviewing his evening notes. I see you, she said quietly, not looking at him. I've got you. His hand tapped once, yes. She had 30 seconds before the med cart came past on rounds. She used them. Blink twice if the memory problems started here. He blinked twice. Blink twice if they were worse before. He hesitated, then 2 blinks. Blink once if something changed when you arrived. 1 blink. Maya closed the chart. She stood, checked his IV line with steady hands, made a notation on the tablet she carried. Nothing dramatic, nothing that would draw attention. When she left the room, her heart was moving at a rate she had not felt since Kunar. The attending psychiatrist on Derek Callum's case was Dr. Vincent Page. He was 51, silver-haired, with the kind of careful voice that made everything he said sound considered, and everything he dismissed sound generous. He had been at Sunridge for 9 years, longer than any other attending on the psychiatric unit, and in that time he had built a research practice alongside his clinical work that the administration was quietly proud of. A trial for an experimental neural assist device, cognitive support implant therapy, early phase, aimed at veterans with progressive dementia, federal funding, private sponsorship, a publication record that made the hospital's annual report look good. He needed candidates with documented moderate to severe cognitive decline. He needed men with credible military profiles. He needed them to stay where they were. Maya did not know any of this yet. What she knew was what she had documented over the previous 11 weeks without quite understanding why. Derek's blood pressure spiked every time a specific medication was administered. The spikes correlated with confusion episodes. The confusion episodes were being used to update his chart toward more severe impairment. The tapping the staff called agitation was consistent and structured, and nobody had listened to it long enough to notice. She brought her notes to Dr. Page on a Wednesday morning during his pre-rounds review. He listened with the patient expression of a man who had learned that patience looked like openness without requiring any. His response to lorazepam is atypical, Maya said. The confusion windows track within 2 hours of the dose every time. I've got 17 data points. Page looked at her notes. Benzodiazepines can cause paradoxical agitation in elderly patients with cognitive decline. That's well documented. He's 57. The brain ages at different rates. The tapping is tap code. Maya kept her voice level. Military tap code, 5x5 grid. He's been spelling words. Page's expression didn't change by much, just enough. What words? Help, ready, signal. He handed her notes back. Miss Quinn, I understand the instinct to find meaning in repetitive behavior. It's a very human response to a difficult situation. What we are observing is perseveration, repetitive motor behavior associated with frontal lobe dysfunction. He responded to my acknowledgement signal. He responded to attention. Patients with cognitive decline often do. I tapped a specific 2-part sequence and he replied with a continuation. Page stood. Document it if you'd like. But I'd encourage you to consider whether your interpretation is being influenced by your knowledge of military culture. A pause that landed like a closed door. You have a military background yourself, I believe. He said it like a compliment. It wasn't. Maya took her notes back. Yes, she said. Then you understand the tendency to find the old patterns in new places. He checked his watch. I'll see him at 9. She kept her face still. She walked back to the nursing station and sat with her tablet and thought about 17 data points and a man spelling help against a metal railing at 9 o'clock every night. Her shift supervisor was a broad-shouldered RN named Carl Briggs, who had been on the unit for 6 years and who trusted Maya's observations more than he let on. She found him at the med cart. I need to flag something on Callum, she said. Carl looked at her. Page already talked to me. She stopped. He said you're going to document a theory about tap code. Carl's voice was careful. He used the phrase boundary concerns. The air in the hallway felt different after that. Not thinner, just more deliberate. Maya went back to her work. She took vitals, updated charts, checked on 6 other patients, administered medications with the same steady hands she always used. She ate half a sandwich standing in the break room at noon. She read Derek's chart 3 more times. She thought about what she was not yet ready to say out loud. That evening she sat outside room 7 again, and this time she stayed longer. Derek was awake. His dinner tray was untouched. His eyes went to her the moment she entered, not with recognition, exactly, but with the particular alertness of a man who had learned to identify the difference between people who came to manage him and people who came to see him. Maya sat down. She put her tablet on her knee. She tapped. He tapped back. They worked slowly. His motor control in the right hand was better than anyone had noted. His responses were deliberate and consistent. She asked if he knew what day it was. He got it wrong by 2 days. She asked if he knew what month it was. He got it right. She asked if he knew what year it was. He paused a long time, then he tapped. Right year. His long-term memory was substantially intact. His short-term was disrupted in specific windows that tracked precisely with his medication schedule. I need to ask you something hard, she said quietly. Tap yes or no. Has anyone given you something you didn't ask for? Pause. Then, yes. At night? Yes. More than once. Long pause, yes. The back of Maya's neck went cold. She kept her hands resting on her thigh, kept her face pointed at the tablet, kept breathing. I'm going to find out what it is, she said. His hand tapped once. She stood and made her notation and walked to the medication room and pulled his full dispensation record and read every line twice. Everything was logged, every dose accounted for. But the lorazepam administration times on 3 nights in the past 2 weeks showed a 12-minute gap in the video timestamp from the hallway camera. She hadn't noticed that before. She noticed it now. She photographed the record on her personal phone before she could talk herself out of it. Then she went back to the nursing station and wrote up a formal safety concern request, incident category, and submitted it to the charge nurse and the patient safety officer simultaneously at 9:47 p.m. with her name on it. She pressed send before the part of her that understood consequences could stop her. Dr. Page arrived at 7:15 the next morning. His expression was the careful version, not angry, worse than angry, concerned. "Miss Quinn, do you have a moment?" They stood in the hallway outside the nursing station. He held her incident report printout. "I appreciate that you care about your patients," he said. "That's not in question." "Thank you. What is in question is whether this level of," he searched for the word, "investment in a single patient is clinically appropriate. I documented a medication timing discrepancy. You documented a camera gap that facilities management has already explained as a routine system reboot. That wasn't in the explanation I received. It is now." He folded the report. "I'm going to recommend a temporary reassignment while we review your documentation history on this case." Maya looked at him. "Reassignment from which duties?" "From this unit. While my patient safety report is under review." "Precisely. That's not standard protocol." "Miss Quinn." His voice dropped to the register that wasn't loud but didn't allow for interruption. "I've been here 9 years. I've seen good nurses burn out on difficult cases and make it everyone else's problem. I am trying to give you a graceful exit." Maya thought about Derek tapping help against a metal rail every night for 11 weeks. She thought about what graceful exits cost. "Put it in my file," she said. She was back on the unit before he could respond. She went to room 7 and she told Derek what was happening. He listened with his eyes. She tapped the summary. He tapped back 2 letters. G-O. She shook her head. "Not yet." He tapped again. D-A-U. "His daughter. What's her name?" He tapped T-E-S-S. "Does she know how to reach your old unit?" 1 blink. "Tell her," Maya said. "However you can tell her to call someone named in your file, someone with clearance." His hand moved on the rail slowly. UND. She left before rounds. She did not look at Paige when he passed her in the hall. She went to the nursing station and pulled her legal notepad and wrote down everything she had. Every date, every dose, every timestamp, every tap code exchange. And she wrote her own name at the top of every page. The call came at 4:30 that afternoon. It was not from Derek's daughter. It was from a man who identified himself as Warrant Officer 2nd Class Ben Gruber, Army Special Operations Command, now retired, who said he had received a message through channels he didn't want to explain over the phone, and he wanted to know if there was a nurse named Maya Quinn at Sunridge VA Psychiatric Center, and if that nurse had made contact with a patient named Derek Callum, using a communication method from their shared training background. Maya stood in the break room with the door closed and the phone pressed to her ear. "Yes," she said. Gruber was quiet for a moment. "He's been in there since October?" 11 weeks. "We thought he was." Gruber stopped. His daughter said he stopped recognizing her. He recognized her. His short-term memory is being suppressed. Maya kept her voice low and even. "I believe it's pharmacological. The pattern tracks with specific medication windows." A longer silence. "Who's the attending?" "Dr. Vincent Page." She heard Gruber pull breath through his teeth. Page ran a presentation at a defense medical conference 8 months ago. Neural implant therapy for severe TBI. He specifically mentioned looking for candidates with credible special operations backgrounds. The room narrowed. "Derek was never going to consent to that voluntarily," Gruber said. "No," Maya said, "he wasn't." 2 hours later, Tess Callum arrived at Sunridge with a woman who introduced herself as a patient advocate from the VA regional office, and a man in civilian clothes who handed the front desk administrator a card that nobody at the desk was senior enough to refuse. The 3 of them walked to the psychiatric unit. The desk nurse paged Dr. Page. The man in civilian clothes said there was no need. Page appeared anyway, because men like him always did. He looked at the visitor badges. He looked at the patient advocate's credentials. He looked at Tess, who was 31 and had her father's jaw and an expression that had been building for 11 weeks. Then he looked at Maya, who was standing at the nursing station with her notepad under her arm. "Miss Quinn," he said, "I believe I reassigned you." I have 8 hours left on my shift. Effective immediately. The man in civilian clothes spoke without raising his voice. Doctor, we're here to request a full medication audit on Staff Sergeant Callum, a review of all administered substances over the past 11 weeks, and an independent neurological evaluation. We have documentation authorizing that request. He set papers on the desk. You're welcome to review them. Page's expression did not break, it adjusted. This is highly irregular. So is what we think happened to him. Page turned to Maya. The careful mask was still in place, but something behind it had changed. You went outside the facility. I filed an internal report first. It was closed in 12 hours. That process exists for a reason. So does the tap code. She looked at him steadily. He was asking for help for 11 weeks. Nobody listened. The room held. The desk nurse stopped pretending to type. Page said, "This will be reviewed." The man in civilian clothes said, "Yes, it will." The independent neurologist arrived the following morning. Her name was Dr. Patricia Owens, and she brought a pharmacologist, a toxicologist from the VA's regional office, and a technician who collected blood samples from Derek, with the kind of careful deliberateness that suggested she had been thoroughly briefed before she arrived. Maya was present for the evaluation at Derek's request, transmitted to Tess the night before, through slow, exhausting tap code while his daughter held his hand, and tried not to cry at the sight of her father communicating through a method she hadn't known he knew. What the toxicology screen found, 36 hours later, was a compound not listed on Derek Callum's medication record. A synthetic GABAergic agent, experimental, capable of disrupting short-term memory consolidation at low doses without triggering standard pharmacological flags. It had a half-life that explained the 12-hour confusion windows. It had a chemical signature that matched a compound under investigation by a private neuropharmacology firm that held a research partnership with Sunridge VA's psychiatric unit. The partnership was with Dr. Vincent Page's trial. VA police arrived on a Friday afternoon. Page was in his office. By the time they reached his floor, he had gathered his laptop and the 3 external drives from his desk drawer and was not yet at the elevator. A security officer named Marco found him near the stairwell exit with the drives in a briefcase and an expression on his face that was no longer careful at all. Maya was with Derek when the ward began to understand what had happened. She sat beside him and tapped the summary slowly, and he lay on his side and listened through his hands, and when she finished he was quiet for a long time. HOWLONG. Until what? Until I remember. She put her hand beside his on the rail, not over it, just near. The compound clears in 72 to 96 hours. Your baseline wasn't damaged, your brain was suppressed, there's a difference. His eyes went to the window. Outside was late afternoon Arizona sun, flat and gold on the parking structure roof. He tapped, YOUKN. I heard the pattern, she said, that's all. He was CALLSIGN. She hadn't told him hers, she'd only used the tap code. She looked at him. His eyes came back to her face, he tapped slowly, AFGHAN. Her throat tightened, I was never in your unit. He tapped again like he was spending something, KUNAR214. She went still. The Kunar extraction. 2 vehicles, an IED impact site, 6 men trapped in a riverbed while a quick reaction force was 22 minutes out. A personnel recovery element had come down a rope in the dark and gotten 3 men out before the QRF arrived and took credit for what was already finished. The name of the person on the rope never appeared in the after-action report. Derek Callum's intelligence unit had been in the second vehicle. Maya looked at him. You were there, she said. One blink. She had spent 10 years not thinking about Kunar, about the cold water, the weight of a man's gear, the way time compressed and slowed simultaneously when everything depended on sequence and nothing else. She had thought she had walked away cleanly enough to leave it behind. Derek tapped RAITH. Her old call sign. The one her team had given her because she came out of the dark and disappeared before anyone could confirm she had been there at all. She breathed once through her nose. That name is retired, she said. He tapped NOITISNOT. Tess was in the doorway. She was watching her father's hand on the rail and watching Maya's face, and her expression had the quality of someone assembling a picture that had been missing pieces for too long. What is he saying? Tess asked. Maya looked at Derek. He blinked once. He's saying he recognizes me, Maya said, from before. Tess crossed the room and sat on the other side of his bed and put her hand over his. Derek's eyes moved from Maya to his daughter, and some tightness in his face eased. Not gone, just eased. He tapped on the rail beneath Tess's hand. Tess looked at Maya. He's saying he missed you, Maya said. Tess pressed her lips together. She didn't answer, she didn't need to. Warrant Officer Gruber arrived the next morning with a colonel named Dana Reese from the Army's Medical Command Inspector General Office, and they met with the patient advocate, VA police, and a hospital administrator who looked like she hadn't slept since Friday. The investigation into Page's pharmaceutical trial was already pulling thread from a larger spool. 3 other patients on the unit had received the same unlisted compound. 2 of them had family members who had been told they were declining faster than expected. 1 had been transferred to a long-term care facility the previous month, with paperwork signed by Page recommending permanent placement. The paperwork was reviewed. The transfer was reversed. Maya gave her statement to VA investigators for 4 hours on a Saturday morning. She brought every page of the notepad. She answered every question twice. She did not minimize what she had seen or soften what she had done. When an investigator asked why she hadn't gone to hospital administration before the incident report, she said that the incident report had been closed in 12 hours and that she had then used the contacts available to her. She looked at the investigator until he wrote it down without comment. At the end of the statement, Colonel Reese asked her to wait, stepped into the hallway, and came back with a sealed envelope. She set it on the table. "This was faxed to my office on Friday from a former SF unit," Reese said. "They said it was relevant to your situation." Maya opened it, a single page. A transcript of a recorded debrief from 2014, redacted in most places but not all. In the margin, handwritten by someone who had known her name then. "If Wraith ever needs the record set straight, we'll set it straight." She folded it and put it in her pocket. Derek's blood work at 72 hours showed no residual compound. At 96 hours, he held a conversation with his daughter that lasted 14 minutes, and he remembered all of it. He asked for coffee, actual coffee, and when it came, he drank it with his eyes closed like a man remembering what things were supposed to taste like. He did not use tap code for communication anymore. He talked. His voice was rough from disuse, and he lost words occasionally and had to stop and reach for them, but they came. Not all of them, enough. He asked for Maya on a Tuesday afternoon when Tess had stepped out to call her mother. She came in and sat down. He looked at her for a moment. "You're smaller than I remembered," he said. "You had a concussion," she said. "Everything's bigger with a concussion." His mouth moved toward something that wasn't quite a smile. "You pulled Whitfield out first. He was the loudest. I figured you'd leave the loudest ones for last." "Loudest ones draw the most fire," she said. "Basic logic." He was quiet. "I didn't know you were here when they brought me in. I didn't know you were you until the tapping." He looked at his hand on the blanket. "I thought I was losing it. For real. I could feel myself." He stopped, found the word, slipping, every day a little more. "And I knew that wasn't right, but there was nothing I could do about it. And after a while you start to wonder if you just can't trust your own." "You could trust it," Maya said. "You were right every time." He looked at her. "Your instincts were intact," she said. "Your memory was being taken from you. Those are not the same thing." Something in his face settled. Not fixed, settled. "Tess said there were others," he said. 3 confirmed. Investigators are still working through the records. His jaw tightened. Page. In custody. The trial is shut down. Blackwell Neuromedical lost their federal certification Friday. Derek exhaled through his nose. A long, deliberate breath, the kind that carried something out with it. "Good," he said. "That's good." Maya looked at the window, Arizona afternoon, still that same flat gold. "Wraith," Derek said. She looked back. "You didn't have to stay." She thought about 11 weeks of tapping against a rail. She thought about a man spending his signal every night into a silence he couldn't be sure anyone was listening to. She thought about what it cost to keep sending when nothing came back. "Yes, I did," she said. He nodded once, like he'd known the answer but needed to hear it said out loud. The Sunridge facility opened a formal military communication assessment protocol 6 months later, mandatory for any veteran patient presenting with behavioral patterns previously classified as agitation, repetitive motor activity, or non-communicative withdrawal. Every nurse on the psychiatric unit completed tap code training. Every attending was required to consult with a military culture liaison before final prognosis documentation. They called it the Callum Protocol. Derek walked out of Sunridge on a Thursday in February with Tess on one side and a cane on the other, and a coffee from the cafeteria in his hand because he had asked for it, and nobody had said he couldn't. At the door, he stopped and turned around. Maya was standing at the nursing station in her blue scrubs, chart in hand, watching. He looked at her for a moment, then he raised 2 fingers. Not a wave, a sign. She raised 2 back. Tess asked him what it meant on the drive home. He thought about it. "It means I see you," he said, "and I've got you." The investigation into Vincent Page's trial found documentation of 16 months of deliberate suppression across 4 patients, 2 of whom were able to testify. The pharmaceutical firm was dissolved. Page was charged on 7 counts, 4 of which carried federal penalties. He did not take a plea. Maya Quinn was offered a position as clinical lead for the new military patient advocacy unit at Sunridge. She took it. She still wore the same scrubs, slightly too large, hair pulled back fast. She still kept her voice low around rooms full of people who hadn't earned her volume yet. But the notepad was always in her pocket. And when a patient tapped on a bed rail and the night staff called it agitation, she was the one who came and sat down and listened. Not every patient had a call sign. Not every pattern was tap code. But every person tapping on something in the dark was looking for the same thing Derek Callum had been looking for. Someone to tap back. That, she told the new nurses during orientation, was the whole job. Not the paperwork, not the protocol. The tap back. The moment when a person trapped inside a broken body, or a broken system, or a broken story understood that someone on the outside could read them. She still had the folded page from Colonel Reese in her jacket pocket. She had not needed to show it to anyone. But she kept it there the same way she kept everything that mattered. Not on display, not gone, just close enough to reach when the moment required it. She never called herself Wraith anymore. But on the day Derek Callum walked back into Sunridge for his first outpatient appointment, and saw her across the waiting room, and nodded once, in that particular quiet way that said everything without saying a word, she thought maybe the call sign had never really been about her anyway. Maybe it had always just meant the one who shows up. She could live with that.